Good morning, everybody. Thank you very much for coming to this presentation on evidence-based interventions for children with autism. My name is Rose Nevill. I'm an assistant professor here at the University of Virginia, and I'm the director of the Autism Research Core within the STAR initiative. So at the end of my presentation, I'm going to talk about a couple research projects that we're recruiting for that you might be interested in. Nicole Zong, my co-author, was unable to be here today, unfortunately, but she helped me prepare this presentation. As we're going through, there's going to be some links that I'll be showing at certain points. You're welcome to take photographs of any of the slides that you're interested in. But as a heads up, we are recording all of these workshop presentations and putting them online on our Autism Drive website, which you'll find in the flyer, in your bags, and in your program. So if you want to re-watch them after today, you'll find them accessible through that site. So as an overview, we're going to be talking to start off with what evidence-based means and what non-evidence-based interventions look like. I'm going to then talk about a summary of evidence-based practices for autism. So we have good news and bad news with this talk. The good news is that there are a ton of evidence-based interventions that have been identified out there, specifically for individuals with autism. The bad news is I have 45 minutes, and I cannot reasonably explain all of them to you in that period of time. So the focus of this talk is going to be to give you tips on how to decide what intervention to pursue for yourself or your family member. And we're also going to talk about, I'm going to present you summaries of what those evidence-based interventions are, links and some recommendations for books to check out after today if you want to learn more. So we'll talk about decision tips, and then I'll conclude talking about those autism intervention resources. So it's difficult to choose and figure out which intervention to pursue for your child because there's a long, what seems like a laundry list of options out there. Who's been overwhelmed before about the number of interventions that are out there that are recommended for autism? There are quite a few, right? And it's oftentimes really tricky to figure out, okay, a friend of mine recommends this, my doctor recommends that, what do I pursue, what's most appropriate for my family member? It's also difficult because most of them are promoted by people who are well-meaning, they're sincere, they really care, they oftentimes have really persuasive arguments, and everyone likes to claim that their favorite treatment works, right? So it makes it even harder for you. You might hear people claim things like, well, it worked for my child, or someone else say something like, it sure seems to be working so far. And because it's oftentimes a friend or someone you trust, you may want to believe what they're saying, and you may want to check out that intervention as well. But just because it works for one child with autism doesn't necessarily mean it's going to be working for the person you know. As I've said in the last presentation, as we're going to be talking a lot about today, everyone with autism is different. So when you're thinking about what's evidence-based versus what's not evidence-based, the first step is to evaluate the evidence that's available to support that particular treatment or therapy or intervention or support you're considering, because not all evidence is created. So some of those interventions are hyped up. People really are excited about them, they talk a lot about them in the news, the media, but we don't necessarily have any evidence outside of hype to say that they work. We also may encounter a lot of people who just engage in wishful thinking. They want it to work, they really like the idea of it, so that helps them persuade themselves to believe an intervention is effective. And other interventions have actually solid proof, and so what I'm going to be talking about is figuring out which of those have solid proof that they're most likely to be effective. There are also, because of the mystery of autism, a lot of what we call pseudoscientific interventions or therapies that have been put out there in the world over time, especially because for a long time we haven't known what causes autism, where it came from, and because of all of these mysteries, we ended up developing treatments that aren't based on any type of scientific evidence and have unfortunately led a lot of families astray. So how do you identify pseudoscientific interventions? These are ones that tend to be most often accompanied by anecdotes, testimonials. They tend to lack research supporting their evidence in peer-reviewed journals. They're unable to test, so they're so complex or they may be so obscure that it's literally impossible to figure out how we could even evaluate whether this is an effective intervention. They may be promoted through the internet only or through word of mouth only. If you Google these types of interventions and try Google Scholar, which is a link on all Google machines, if you can't even find a title of a research article evaluating that intervention, that's probably a bad sign. So what I like to think of or reference when I talk about these is those late night QVC commercials, right? Where you say, hey, call now, this face cream will make you reverse your age by 40 years in a matter of 10 minutes, right? They promote, and we tend to see people promoting these types of messages around non-evidence-based or pseudoscientific interventions as well. So people claim really high immediate success rates. They're effective claim for many symptoms, not just specific symptoms such as language or challenging behavior. The theory behind these interventions contradicts common sense. So rely on your common sense when you evaluate these options, because if it doesn't make sense to you, the odds are it probably doesn't make sense in general as an intervention. They're boasted to be easy to administer, quick, require little training or expertise. So a lot of these old school medicine ads that we see, for example, this one is I cure women, this little box, this tiny little box of it, one ingredient cures all women of all female diseases in piles, right? We're claiming high success rates for every possible disease that a woman may ever encounter. All you need to do is take it, it's quick, it's easy, you just call now and you can have it. So those are red flags we need to watch out for when considering to use an intervention or not. Promoters tend to benefit financially or otherwise, so that's also something you want to bear in mind. So if someone is trying to individually sell an intervention to you, it's not being offered through a therapy clinic or licensed clinicians, that can be a red flag. People say that you need belief and faith. If you don't have belief and faith that these things are going to work, then you're not going to see outcomes or you're not going to see benefits. What we want to hear people say is, yes, you do need faith, but we're also going to show you data. We're also going to show you evidence that this intervention is going to be effective. Promoters tend to ignore negative findings from research. They ignore them, they dismiss them, they say, those people just don't understand, and they accuse people who question these interventions as being closed-minded. So keep an eye out, keep an ear out for people and interventions that are being promoted in these ways, because these are the ones that you may not want to be considering. So what does evidence-based practice actually mean? So what that means is clinicians, scientists, researchers, therapists, doctors out there have spent a considerable amount of time testing these interventions in controlled settings, in labs, in classrooms, in homes, and looked to see how well they work with specific populations or work with specific conditions. We also are looking for the fact that clinicians are using procedures that have been studied carefully, and we're looking for those results to have been reviewed or published. So unless you work in an academic institution, you may not have access to a research library, right? No one expects you to do that, but what you can do is check out parent-based resources that are available like this and other resources I'll show you at the end that translate that information from these published articles for parents and community members. Here's a video that hopefully will work. It's geared towards explaining evidence-based intervention, evidence-based practice for post-traumatic stress disorder. So, but what I found is that this actually applies a lot to evidence-based practice in autism as well. So just ignore the reference to PTSD and let's check this video out as an example. You better play. Don't you do this now. All right, you two. All right, it's not going to work. But basically, what this article describes is the fact that what researchers do is that, in fact, we have the beginnings of the bubbles there, multiple independent researchers that aren't associated in any way. They investigate this intervention, they test it out, then someone else comes along, does a review summary, tries to summarize all of the evidence, and then from there figures out, okay, how effective is this really? So a ton of work goes into figuring out what an evidence-based intervention is. And because a lot of people invest their time and energy into figuring this out, it's great because then we can come along, the work's already been done to us, we can then figure out, okay, as a consumer, what should we be tapping into? So evidence-based practice combines professional expertise, along with what I've already referenced, the best available research, and then figures out, based on the individual characteristics of that person, what intervention, therapy, or service should we be pursuing? What does the evidence and professional opinion say would work best for my child, or myself, or my family member? There are 2 organizations that are out there that have published really nice community and parent-friendly resources. These are the National Autism Center and the National Clearinghouse on Autism Evidence and Practice. National Autism Center is at the May Institute up in Massachusetts. The second resource is through the University of North Carolina, Chapel Hill. And so what they've done is what I just described, that process of looking at all of the research evidence that is out there, compared it, summarized it, and then from there identified lists of what the evidence-based autism treatments are. So here is a very long list. I'm not going to explain all of this to you because we don't have time and you wouldn't remember and you'd hate me for it. But the takeaway is this sheet that everyone should, does anyone not have this sheet? Okay. You pass that back to the gentleman in the blue jacket, please. So what you'll see on this sheet is a list on the left-hand side, a blue column, of all of the interventions that are on this screen that have been identified as being evidence-based. What you'll see along the top is all of the interventions that have been identified by the National Autism Center as evidence-based. All these check marks, all that means is that both groups have agreed that these interventions are evidence-based. So if you go to the websites for these institutions, you will find parent-friendly one-page guides on how to implement these practices. You'll also find free online tutorials on how to learn how to implement these practices. But really, the good news is that there are a lot of these different interventions out there. What's important to also note is if you look at the screen, the bolded ones are all behavioral interventions. So these interventions all use the principles of applied behavior analysis to promote positive behavior and reduce the occurrence of interfering behavior or problem behavior such as aggression, disruption, promote learning. And so as a whole, you'll see the majority of evidence-based practices use these types of components like reinforcement. Who's heard of positive reinforcement before in this room? Most of you, right? So a lot of these interventions use ideas such as positive reinforcement, ignoring problem behaviors, because what we know is that there's decades and decades of research out there showing us that these work. In addition, so this gray box at the bottom of your sheet, there's additional evidence-based practices that have been supported by the National Professional Development Center at UNC that haven't quite been looked at by the National Autism Center. But so what we can conclude about these is that these have emerging evidence. Power of exercise, right? Who thinks that exercise is helpful for relieving stress, helping mental health, right? So we have a lot of evidence out there to say that exercise is helpful for increasing positive behavior, reducing problem behavior in individuals with autism. Functional behavioral assessment, functional communication training, picture exchange training, and then structured play groups. These are also interventions that you may want to read up on, learn about, or ask your child's support team or education team to learn about. So, how do we quickly summarize these interventions. It's not very helpful for me to just show you a long list and send you out into the world. So I'm going to try and summarize these interventions for you to identify what are the common themes so that you can also look for these characteristics in interventions as you're considering them. So a big theme across all of these is that they emphasize early intervention, getting access to an individual with autism, getting that person access to therapies early on in their lifespan to promote maximum opportunities for positive outcomes. They also promote daily routines, interventions that say, okay, do this a little bit, maybe once a week or twice a week. Those tend to have less evidence because we know that individuals with autism, they have a strong preference for routine, they have a strong preference for structure. So if we can implement interventions and support, whether it's practice, working on language skills, or practicing being okay with transitions, it's best to build that into a daily routine so they have regular exposure to these interventions. On that same token, using consistent strategies is particularly important. It's also incredibly important that you are regularly tracking outcomes. So talk with your service provider about how you, as a caregiver, a parent, can track outcomes so you can yourself identify whether this intervention is working. You don't want to assume that it's just going to be the service provider doing that. They are going to be doing that, that's their job. But we also want to make sure that the outcomes that your child is getting from this intervention are meaningful in your family's life, in your child's life, from your perspective. Because if you don't see meaningful improvements, then what's the point, right? So track progress. Work with your clinician to figure out how you yourself as a care provider can track progress. If you're implementing an intervention, do regular check-ins to figure out, okay, am I doing this correctly? Work with your clinician, a service provider. Review those materials that I'm going to show you the links for online regularly to make sure that you're staying on course. And parental involvement is incredibly important because since you're there every day, you're in the strongest and the best position to be able to deliver those supports regularly to your child. There are a number of treatment packages that have also been developed that are out there. And the reason I'm showing you these treatment packages is that they have emphasized using these, combining these skills into the same intervention. So that intervention package is going to use things like reinforcement, ignoring problem behavior, teaching positive social skills. And these can be divided into two categories. The first category is applied behavior analytic interventions. So again, as I mentioned, a lot of evidence is out there for behavioral interventions and supports. The second category are those naturalistic developmental behavioral interventions. So what's the common word between these two? Behavior, right? So again, the theme here is we've got a lot of evidence for behavioral intervention. These categories of treatment packages both do a lot with emphasizing learning positive behaviors, reducing problem behaviors through structured, systematic techniques. So who has heard anything negative about ABA? A lot of people, right? So that's the concern that many families have when they first consider ABAs, because there's a bad reputation out there about ABA, because oftentimes what we see is people being exposed to a lot of trials over and over again. The therapist may be cold, they may be taking things away, it may be negative. That's the old school style of ABA, and what we've seen is that in more recent years, there's been a ton of emphasis and ton of work put into place to make sure that ABA is not like this. ABA is focused on providing children and adults access to things that they like, rewards, in exchange for engaging in good behavior, or positive behavior, or appropriate behavior. That's what naturalistic developmental behavioral interventions do as well. But there are some slight differences. So who leads in each case? In ABA interventions, it's the adult who's leading. So in these interventions, the adult is setting up a situation. Maybe you're going to work on academic tasks, for example. You're prompting your child, okay, we're going to do some academic tasks. In naturalistic developmental behavioral interventions, it's a little bit different. Here, the emphasis is on parents or caregivers or siblings playing with the child and then following their lead. So if the child picks up this toy, the focus is then shifted onto that toy. We're now going to label the color of that toy. We're going to look at how it works. We're going to focus on turn taking with that toy. So it's oftentimes focused on the parent following the child's lead, following them around the room, playing with them, so that they can again focus in on what's motivating that child to get them interested and help them learn. So adult and applied behavior analytic interventions, adults tend to base materials based on the child's likes. As I just described in my scenario with the naturalistic developmental behavior interventions, the adult tends to follow the child and just focus on whatever the child is focused on at that time. You use both of these packages in natural environments, but we also can see that ABA interventions can also be set up in a classroom setting. They can be set up in a small room with a table and chairs if you feel like your child tends to be distracted quite frequently by external noises or distractions. And we tend to see that ABA is more structured, whereas these other interventions tend to be less structured because, again, they're following the child's lead around the room. Discrete trial training is an example of a package that's based heavily on ABA. And here are a list of intervention packages that are out there that are considered naturalistic developmental behavioral interventions. Has anyone heard of Early Start Denver model before? A couple of you. So that's an example of an NDBI. It's, again, child-led, focused on play. Jasper is another one that has a ton of really nice evidence out there, and there are books online that you can buy. Pivotal response treatment and impact are other examples of NDBIs. That's a mouthful, isn't it? Gosh, I'm not going to say that again. So, does anyone need me to do that? I see some bones. Okay, so I have a video next. Let's hope this one works. This shows NDBIs. I did it. Let's see what's that. Okay, so we'll abandon that video. But this was going to be an example video of a grandmother implementing this type of intervention with their son, her grandson. So what she was doing, she's following about, looking at what toy he was picking up, commenting on that toy, labeling it, taking away, waiting for him to ask for it back. If he asked for it inappropriately, ignoring that and encouraging him to ask appropriately for the toy. So it's really very child-led. She's following the child, commenting on what the child's doing, and naturalistic, so it can be done in any environment.